Good afternoon, everyone. My name is Angel Valgas Prats, and I'm the assigned host for this afternoon webinar. It's a pleasure to welcome you to another webinar in the MicroTalks Exploring the Microbial World series, organized by the Puerto Rico Society of Microbiologists. This series brings together experts to discuss the latest developments and innovations in microbiology, helping scientists grow and advance in their careers. Now, I will introduce the person in charge of this webinar titled Let's Talk Micro from the Bench to Podcasting. His name is Luis Plaza. I'm going to read his biography. Luis Plaza has a solid academic background in microbiology with a bachelor's degree in medical laboratory sciences from the University of Central Florida and a master's degree in microbiology and cell science, which he will complete in December 2024. His passion for education and science has led him to serve as an instructor at the University of Central Florida, where he teaches clinical microbiology to medical laboratory science students. Currently, Plaza works as a lead medical laboratory scientist at Advent Health Orlando, overseeing microbiological testing and ensuring compliance with laboratory safety standards. In addition to his professional experience, Plaza is the creator and host of the Let's Talk Micro podcast, where he shares his knowledge and discusses current topics in microbiology, inviting experts in the field to promote learning and awareness in medical laboratory sciences. Among his experience, he has worked as a technology in chemistry and hematology laboratory and as a medical laboratory technician at the Naval Hospital, showcasing his versatility and commitment in various areas of laboratory sciences. And now, los dejaré con Luis Plaza.
So, hi everyone. Good afternoon. Thank you. First of all, thank you to the society for having me. It is a great pleasure and honor. And I have to say it's really cool for many years, and even though, and I'll talk about my background a little bit, but a lot of my professional career and my education has been in the United States, even though I was born and raised in Puerto Rico. So a lot of times, it felt like two separate worlds. I'm working, I'm doing my thing here, and then, I go home, see family, and just the fact that I'm able to talk micro right here with all of you at home, it's a pleasure. So once again, thank you to the society for the opportunity. So I'm going to be sharing my story a little bit, and I'm definitely, as my bio said, I worked many years in the laboratory. I worked in many areas, and maybe if there are any medical laboratory scientists in the audience, or maybe students, medical technology students, as we also call them, that after you finish that degree, you can work in different areas. So I have tried different ones, but definitely I have spent a lot of time in micro. So I'm just going to start by telling you a little bit about myself and my journey and how I ended up doing this Let's Talk Micro podcast. So I was born in Ponce and then lived all my life in Mayagüez, in Puerto Rico. I started college a little bit. I did like 1 year, and to be honest, I don't know. I think I had a hard time adjusting to university life, meaning balancing, studying and then like going out with friends and things like that. I had a little bit of trouble keeping that balance. So I saw that I needed to grow, mature. So I went ahead and I joined the Navy, and I spent like 8 years there. I definitely grew up. I matured. I realized, I needed to continue my education. So I set up to do that. And I did it, and I got a bachelor's of medical laboratory sciences at the University of Central Florida in 2013. And I'm currently almost done with my master's that I'll be finishing in December. And I am certified by the American Society for Clinical Pathology in all the areas of the lab, and I'm also licensed to practice laboratory medicine in the state of Florida. So discovering microbiology, and I mean, I don't know, like when I went to school and And you definitely, right, you take biology, you take chemistry, and you really don't learn a whole lot about microbiology. So I think my discovery of it was pretty much by the time I was in the, in the college years and in the military. So while I was in the Navy, I was a medic, their version of medics, which is a hospital corpsman. At that time, not a lot of college studies. But I see that my contract is coming to an end. And I definitely knew by then that I wanted to get a degree. I wasn't quite sure in what yet. But after working many years, and being a professional, being able to afford my bills and everything, it felt like I don't know, do I go home and then go to college or at least I want a job where I can support myself while going through school. And I went ahead and discovered that they had a medical laboratory technician program, which is that's something that's available in the US. But it's basically an associate's degree in medical laboratory sciences or medical technology. I know that we're trying to merge the names. But for now, you hear some people medical technologists, some medical laboratory scientists, but it's the same. So it's an associate's degree. And the scope of the job, it can vary between institutions for that associate's degree. But basically, you can do about the same job as a medical laboratory scientist, but you get compensated less for it. But you do work in different areas of the lab. Also, one appeal that it had to me, and I'll talk about me being an introvert. There's a little bit of a limited face-to-face interaction where you don't directly deal with patients. Your patients are actually your phone calls with your nurses and your doctors, but that face-to-face contact, it's very limited. So a lot of times introverts, they see this, they see it appealing and attractive because maybe you don't have to deal with that many people. That might be changing, but there's still some truth to that. And I'm going to put it on the full presentation here. Okay. So what is a medical laboratory scientist? So this is a professional in the healthcare field that performs various types of testing. And maybe we don't think much about it when we're maybe growing up, but we do know, right, that we have to get our cholesterol checked, our hemoglobin. So maybe we go to one of these, outpatient labs where we go get our blood taken and then we get our results maybe a week later or so. But that's what we do. We provide valuable information that is used by physicians and other healthcare providers to diagnose and treat patients. Anything, as I mentioned, from hemoglobin, cardiac markers, lipid profiles, and of course, identification of microorganisms with susceptibilities. And that's something that even if we don't know much about the lab per se, I mean, at some point in time in our lives, maybe we had a bacteria ourselves, or we know of someone that had some sort of infection and they get put on antibiotics. So upon completion of that program, you can work in several areas of the lab: hematology, immunohematology, clinical chemistry, and microbiology. And there are several pathways to do this, and these are some examples. I mean, there's a lot of variety, especially here in the United States, where you do, there's like a 2+2, where you end up with a bachelor's, but the first 2 years you have to take some prereqs, and then you finish your 2 years taking some didactic courses, and then of course doing your practice at a hospital. You also have like a 3+1, which is a version of that 2+2. And then you also have a post-baccalaureate program where you already have a degree and maybe you complete a 1-year internship. All different pathways. I think one of the unfortunate situations with this profession, and it's getting better, but not too many people know what it is, right? I think when we think about healthcare, we think about, okay, I want to be a doctor, I want to be a nurse, or you go full on to research on the other side or something like that. But you don't know a lot about this. So a lot of people have already completed some sort of degree and then they realize, hey, this is an option. So they go back. So it's very typical, at least, here in my experience, when you're going through a program like this, where you have a typical, 21, 22-year-old going through college. And you can also have like a 30, 31-year-old going through, which, they already have a degree, they work on something, and then they decided, okay, this looks like a good fit for me. Let me go ahead and try. So they go back later in life to complete the program. So what's the day in the life? And this is specifically for microbiology because it's what I do. Um, so perform various sample types. We do gram stains for like blood, cerebrospinal fluid, swabs, right? We think about when we hear maybe in the news, we think about meningitis and things like that. There are some bacterial agents that can cause meningitis. So we examine, cerebrospinal fluid, or maybe you have septicemia, and then you get some blood collected, and you look for that, or anything as simple as getting a cut. Maybe you have some sort of abscess or some sort of infection, and then they collect a sample, and then we analyze it for the presence of a microorganism. Typically bacteria for the most part, but you also get fungi and other organisms. So we get those, we prepare those stains, we inoculate the samples into the media. We also do a wide variety of testing, right? Like strep testing, right? You get that sore throat, you go in, you get checked in. Of course, COVID, right? That was a big thing, and we had no life when this happened. A lot of testing, a lot of testing. So we were definitely very busy. PCR testing group B strep, um, which is very important, right, on pregnant patients to make sure that we rule out the presence because it can cause, neonatal sepsis. We also test for parasites. And of course, one main part of it, big part still, even though molecular testing is definitely getting very huge in the field, but we still do actually a replace where we're actually seeing the organisms and we're looking at them, and then we're performing testing to provide an identification, right? And of course, not because something grows, that means that it is a pathogen. So we kind of have to do that correlation between the source and the organism. And we know that all over our bodies, we have bacteria, we have microorganisms. So we have a microbiota, which is very varied, and then it can differ per site. So we have to keep that in mind as we are recovering, looking at these cultures, that, okay, this particular source can have this organism. So we kind of have to be careful as we are working them up. And of course, susceptibility testing as reported, right? Do the patient, is this organism a pathogen? Do we need to put the patient on an antibiotic? So we test for which ones the organism is susceptible to. That way, the physician, the doctor can actually pick the right one, and the patient can respond to therapy and get better. So what does it entail? So we evaluate cultures from various sources of, like as I said, for the presence of microorganisms. We provide an accurate quantitation of growth. And if growth is present, we determine if it's pathogenic or commensal based on the source. Some organisms are typically part of the normal microbiota. Some can be opportunistic and given the chance can cause disease. So we make those determinations as we're working the cultures. And then we perform biochemical testing to make sure that to aid in the identification of it. And then based on the guidelines that we have, we report the organisms. And of course, we do susceptibility. So we test for those antimicrobials or antibiotics, making sure we're releasing the right ones, that it is appropriate for that particular organism, because not all antibiotics work for every organism. Some have a natural resistance to them via different pathways. So we have to make sure that we reporting the proper ones for that. And this is an example of this will be like a quantitative culture on a urine sample. And this is Staphylococcus aureus. Right? Definitely we hear about Staph aureus. We hear about hospitals. We hear about MRSA, methicillin-resistant Staphylococcus aureus. So we know this organism can definitely be serious, and a lot of us are colonized with it. But given the chance, and then it gains access, and it can really cause damage. And then, of course, the training for this, and as I given all this, keep in mind all the information that we have to know as we work, right? So this is one of the main reasons, and I'll talk more about this when we get to the why I did the podcast. But of course, now you start getting an idea of all the stuff that we have to keep, right? So you're training in various web institutions. So first of all, you're taking you go into a program where maybe you spend 2 years at the most, and that includes your rotations at the hospital, right? Your practicals. Um, so then you graduate and then you go to a hospital, and then depending on the institution, they can train you maybe 3 or 4 weeks. You're not going to see everything. You're not going to do every test, but typically, depending on the person, about about 4 weeks is where you get comfortable enough where you, okay, I can work by myself for most of it. And then if I get stuck, I know I have to ask questions and maybe talk to my supervisor or talk to my PhD in the facility, or ask him a question. If you're experienced, sometimes they might train you shorter because by then, right, the bugs are the same. So once you have been doing this for a while, it's about knowing the protocols of that hospital or that institution that you are. So it might be shorter, getting familiar with the computer system. With that in itself, it can sometimes be challenging depending on the system. So it varies with the experience. But you have to know and get familiarized with the resources. And then when you're training, definitely get familiarized with the policies and procedures at your institution, which they derive, especially in micro, they are derived from the sources that I'm about to talk. Why microbiology? For me, right? I mentioned that, and as in my intro, I worked in chemistry, I work in hematology, I work in blood bank, and I always had this gravitational pull towards microbiology. I don't know, it's just one of those things. I've been accused of, loving it too much, of really like being the love of my life, or things like that. Some exaggerations, but I'm very passionate about it, and I really like it. And it's the one place where I feel the most comfortable when I'm working. Um, so this is just a picture of this is just one minor part of what I was reading one day, and this is just looking for anaerobes. So that's about it. It's just one stack of anaerobes. And it's not the worst day. I work in a facility that has a very high volume. So I find it fascinating to learn about microorganisms. There are so many of them. Only a very small percentage we can actually culture them in the lab. Um, so some are part of the normal flora, as I mentioned. Some even are part of the animal, like dog or a cat. Their flora, and then they're transmitted to us, like Pastorella, for example. Others, they just live in our bodies and they don't really harm us. They're just there. But you have others that are definitely pathogenic, that we get them. They're always pathogens, right? Like I think about salmonella and things like that. That's not normal flora in us. Um, and some are opportunistic. So given the chance, they will definitely cause harm. Another fact that I love about this, I don't know, it's just like the media and the components. It's something also, maybe it's like very visually appealing to me. So that's a small part of it. But that's something I also really like about what I do. Um, Also, I like, I love biochemicals. I love learning about different susceptibilities. Why does the organism, resist this antibiotic? Or maybe why this antibiotic used to work and now it doesn't? Or maybe I used like some gene of resistance that maybe is not typical for this part of the world, but you do see it based on, travel and how connected we are nowadays. So I also love learning, solving the mystery. It's just, I don't know, it's just something in the lab. Those of you that maybe are considering a medical technology, you pretty much you kind of quick find out what you like and what you don't. But it's actually, for me, it's the mystery of, all right, we have something, we have to solve this and see what it is, see what antibiotic if needed. But however, you put all those things aside, and the one thing that I love is the actual, which is the most important part. It's how the impact that this work has on patients, right? It's just, we go back thinking about that family member, or even some of yourselves, where you have that infection, or we have someone really sick in the hospital. And then, okay, they say, well, he has this bacteria, and then they put on this antibiotic. So us making that analysis and putting that information out there and knowing that the impact, because it's depending on some patients, unfortunately, right, they pass away before we get the results. So knowing that we are able to help a person and knowing that they will maybe respond to that therapy and get better, it's very fulfilling, and it's just such a huge impact that we do in healthcare that it's just right. This is one of the proofs, like the importance of what we do. It's just we're arming the physician or the healthcare provider with all this information so they can make the determination of treating their patient. So it will be more challenging without them having all this lab work, right? You can rule some things out and then kind of focus or rule some things in. So it's a huge impact. And just talking about visual, this is just a very common bacteria, Serratia marcescens, which produces a red pigment. So I think I'm pretty much in most basic micro classes we kind of see it, and it's just I don't know, it's cool, the color. So getting the bug to talk. So now that you know what I do, why I love it. Um, so you're thinking, okay, well, maybe sounds like a good job, very important. So why a podcast? Why get doing something outside of this? Um, so I think after a while for me, I started getting better at my job and getting more proficient. This is after all a lot of repetition. And as I mentioned, there is so much information. And I found that for me to get proficient, a lot of times, I have to do a lot of self-reading and a lot of things. And it was definitely challenging to learn in the lab. Um, you're moving at a very fast pace. You kind of want people to teach you, but you have a job to do. So you're moving along. It's just, okay, just do what you know. And then if you have questions, just ask. But learning the why are we doing this? Why are we doing this test? Why not this or why not that? I found myself being very inquisitive with that, which I think along the line maybe rubbed some people the wrong way. I don't know, it was like maybe like in a way threatening or I don't know, it's a combination of things. But I definitely always wanted to understand more. And I think that's just knowing more and knowing the why behind some things, it makes you more effective at your job. It's just not following a recipe, right? It's just you're talking about patients here, human beings. So I think we we owe to them to do the best work, and that means learning and getting more proficient and acquiring more knowledge. Very early instance of the of the podcast, I thought about maybe creating some sort of micro club where when I came in, some of the maybe younger, more new medical technologists, we could all get together and go over textbooks and things like that and help each other out so we could all grow professionally. I think it's getting better. But when I started in the lab, there was like this huge divide of people that had been working for 30 years with like a rich knowledge, and then people that had just graduated from school. And I don't know, I think a lot of times it was hard for them to see us as equals in the workspace. So they wanted to see our knowledge, and I thought about something like a club or some sort, but it never took off. I got busy with things and I never followed through on that. And I felt like I wanted to do something different. At times I kind of thought, okay, maybe I can do more. And it's not really this is something that I learned after I talked to someone and excuse me. It's not about more or less. It's just about something different. I think that I could maybe make a different contribution in the laboratory field. So, and there's some different ways that you can do that when you're in the lab. So you can do that via being a manager, which pros, maybe you get more involved with test implementation. Um, One big appeal, people bring the more complicated cases to you. So if you like that mystery solving, it's definitely, a thrill. People bring you the complicated cases. Your facility might send you to conferences and because you're the manager. So I think overall you can professionally grow more. So that is one way that you can kind of do something different rather than just working in the bench. The cons, excuse me, I'm gonna drink a little bit of water. The cons, people management. If you don't like people management, it can be challenging. Different personalities. Um, this is unfortunately a field where we work a lot, so you get people that get burned out. Um, you can unfortunately get some very toxic personalities, but because we need the people, it's kind of hard. So, so you kind of keep them around. So it makes it challenging. You also have to deal with things like schedules and training. So it can get you away from the science if you go that way. A lot of times you kind of feel like maybe like an administrator type of. Um, so it will definitely distance you a little bit from the science. You can also go to, the educator route, go teach. But for that, I mean, you can work in the lab with a bachelor's degree in medical laboratory sciences, as I mentioned, even with an associate's in some as an MLT. But for being an educator, you actually need at least a master's degree. So that's something that if you're considering that route, you have to go back to school if you haven't already. The same thing with research. More than likely, you're going to need some graduate studies, or if you want to go work in a lab, or maybe think about a PhD. And you can also work in the industry, which is, there's companies like bioMérieux or Roche or there's other companies that manufacture instruments that they make, antibiotics and things like that. There's many ways that you can work with them. But those might require some traveling also. So if you're not too big into, right, leaving your house for a couple of days a month or however many days, this might not be for you. So let's talk about, a little bit about my story. So one thing about me, right? I am a huge introvert. That has been one of my challenges. Talking to people, it drains me. It's just I sometimes, and unfortunately we get a bad rap. A lot of times, introverts, we feel uncomfortable, we're quiet, we don't say anything, and then we come across as rude, perhaps. We're not very nice. I heard them all. But it takes us a while to get out of that shell and talk to people sometimes. So this is something that definitely I have faced my fears by doing this, the podcast and doing things like I'm doing right now. So, but I did realize that for me to be noticed, I had to come out of my shell, and someone told me, hey, you do a good job, but no one knows really about you. You're just doing your thing there. So you have to come out. So I felt like I had to just start doing self-marketing, really selling myself. Hey, I want to do this. I know I can do it. But it felt like exhausting at times. Like I don't know. Maybe no one is buying it. I'm trying here. I tried the management route, administrative tasks. They pulled me away from the science. A lot of times I felt alone, like not a lot of support. So it seemed like, that wasn't a good fit for me. Then I saw a teaching opportunity that came along, and this is one of those things, a little quick, like it's a scenario where like on a Friday, I hear, hey, the professor at UCF, which is the school I went to, University of Central Florida, he's leaving. Let me reach out to the director and see if they need help. And I did, wrote an email. Next thing you know, next week, I was sitting with them and I had a job. So it was that quick. And of course, the fear of talking to people, but I realized that when I was teaching, that fear just went away at the time. I always realized that I love training people, talking about the science. So when I was doing that, I was coming out of my shell and not being an introvert. So I challenged myself to that opportunity. I went ahead and I took it. It went away when I stood up in front of that room with like 30 students the first time. It went away. I realized I like it. So I can see myself teaching. So let me go ahead and pursue some more studies. So I went back to school and I started working on my master's. Now, why a podcast? Right? Podcasts have definitely become very popular over the years, very convenient format, and I'll definitely talk more about that. At least, on average, all of us pretty much, we listen to one podcast or another. It can be any topic, right? Um, so why? So as I mentioned, this job, it requires knowing so much great information. Organism's name, reactions, knowledge of susceptibilities, antibiotics, which ones are resistant, which ones are not, which ones are indicated for that organism, and then putting all that together. So for the next three slides, just bear with me a little bit. I'm going to go as fast as I can for them, but this is just so to give you a visual of some of the resources that we use and the amount of information that they have. So I ask you just bear with me and then we'll get through this real quick and then we'll continue talking about the podcast. One of the big resources that we use, Clinical Microbiology Procedures Handbook. So has all the procedures in the lab, all the information about gram stains based on the source, right? Depending on the area that you're collecting that sample. What is the transport, the temperature, the incubation, which organisms should we be looking for based on that source? It even has information on bioterrorism procedures, right? You never know when you can get a sample of anthrax in the lab. Fortunately, most of us in clinical microbiology, at least, here in this part of the world, we will never get it, which is a great thing. If you're working with a veterinary population, then that's different because you can see it like in cattle and things like that. But in a human population, more than likely you never see them. But you still have procedures and you have to be ready because you never know when that's going to happen, if it could happen. So it has that information. And then to complement that, there's also the manual of clinical microbiology. And this one breaks down the organisms more by groups, even has information between bacteria, both aerobic, anaerobic, mycobacterium, like Mycobacterium tuberculosis, the causative agent of TB, tuberculosis, fungi, right? Parasites, testing results, diseases, media, reagents, and also antibiotics. It divides them in classes and then which ones have activity against which organism. And then, of course, when we talk about susceptibilities, here, this is where we really find a lot of information. So you have all the antibiotics. It tells you which organisms are resistant to which ones there's not enough information for them to make a proper determination. It gives you interpretations, right? So this drug at this concentration is considered susceptible. So it's a good choice to give to the patient. This one is intermediate, so proceed with caution. This one is resistant. It's not indicated for therapy. It also tells you quality control, all the things, incubator temperatures. As you know, in order to successfully either recover organisms, the ones that are culturable, we have to keep certain conditions in the lab. So sometimes, some requirements like temperature requirements, CO2 accessibility, water, and things like that. So all that information is provided in this resource. Okay, so thank you for pushing through that. And then, so as far as observations, as I mentioned, getting proficient, it was challenging, some barriers to learning. There's so much material. You go to school and you could actually only antibiotics alone, you could probably go 2 or 3 years fully working on that stuff, and then and you wouldn't cover everything. There's so much material. Yet your average medical technology program, it's 1 or 2 years. So as I mentioned, your training varies. Not one in the lab. Sometimes if you want to learn a lot, there are some barriers. People might see it a little threatening or so a lot of times the spaces that I've been in, maybe one person is get picked to learn the procedures, to make the manager's life easier. But there's not a lot like, hey, I want to learn. No, we're moving fast paced. Here's the recipe. Go ahead and do it, but don't ask me much about the why, the behind. Do it on your own. But then if you go on your own, there's so much information that sometimes it can be confusing. So also, as I sat through these cultures day in and day out and looking at this, I learned some things about their growth, some patterns that I noticed. No one ever taught me that. I'm like, okay, why not make it easier and maybe start sharing some of this information with you? So with people. And as I mentioned, learning is very crucial in this job. If you don't have confidence, you're in for a very long day because you're dealing with samples, right, from areas of the body that are full of bacteria. So you have to use judgment and make determinations, keep a lot of things in check, and your mind to properly make a report, right? Sometimes releasing a lot of information it doesn't help the physician a lot. When you say, okay, I have 6 organisms here, but then maybe this are normal flora, here's this. So we kind of want to provide, a better picture so we can help the patient better. So, and I say this a lot, but definitely information is all over the place. And then you have the life factor. It's kind of hard for people, and, for everyone. You're working in the lab, you're working 8 hours, let's say. You have life to take care of, right? a lot of our workers, you get single moms or parents that, that they have to work to support their house. After the time goes, after the time is up, the 8 hours are up, they have to go home, right? They have to go pick up their kids. They have to do homework. They have to do all these things that you don't have time to go sitting and reading over journals and things like that, or going over textbooks. It can be very challenging. Right? You come out of the lab exhausted, and right, and then what are you gonna do, right? You're gonna spend some time with your family as you should, and things like that. So it was it's definitely challenging. So I started thinking, some of the way of cutting down on some of those barriers to learning and making things accessible. As I know by now, I like to talk about what I do. I like sharing knowledge. And I thought of a podcast, but honestly, at the time, maybe a little bit, it seemed like it was too much work, but it was because I hadn't done the research yet. So I kind of put it on hold, didn't think much about it. I continued trying to pursue other traditional alternatives so I could do more or do something different. And I think that for me, it's just 2021 happened. Yeah, it's one of the worst years to date for me. Someone that I'm not going to talk much about this, but someone was diagnosed with a terminal disease. That was a lot. It still is a lot. I applied to a doctorate program. I got rejected. I applied to a job that I knew that I was qualified for. I did not get it. So I felt like a lot of rejection, a lot of bad things my way. And it makes you question, here I am selling myself, trying this, what's happening? It kind of works at you. It's like, what's going on? Am I not good or what's happening here? So I just decided, what, I'm going to do what I like, what I'm passionate about. So I'm going to talk micro, which is what I really like. And Let's Talk Micro was born. I did my research. I realized that, for basically to create a podcast, what you need is a microphone. Uh, um, any Google search or any other engine, you get a lot of alternatives. You need a recording software, which it can be as easy as, if you're a Mac user using GarageBand. Also, if you're doing just like we're doing right now, you're doing a meeting in Zoom, you talk to someone, you record it, and you convert that into an episode. You need a podcast platform, many different providers out there. You need a logo, like the one I have here. And of course, you need a theme and a title. What is it about? What are you going to be talking about? The process, as I mentioned, it's not really difficult, but it is time consuming. And you need to make sure that it's properly done. And one of the things if you want to do a podcast, and I think depending on the reason that you have, if you want, with me, and I mentioned this before, I really enjoy the process. It's very therapeutic for me. Just sitting there and talking about something, I don't know, it really relaxes me. And I know I'm a huge nerd, but it really helps me out. But if you want to do this, if you want to make sure that people hear it, if you're going through all this trouble and you want to make sure that your product, right, it's reaching people, you have to be consistent. I assume that people are always listening to it. And that's what I did from day one. And then that the information is accurate. So for that, you have to go, especially if you're talking about something science related, you have to go to your books, make sure that you pick a topic and you write a script, and it's just to organize the information, but making sure that you go to journals, textbooks, and make sure it is accurate, right? It is one thing when you've been doing this for a while and you know the information in the head, but making it in a way, same with teaching, right? When you teach, you have to go ahead and prepare a lesson plan, go over the information, make sure that you're putting accurate information out there. So we do this with a podcast too. And then you book your guests, which is something very surprising that people do want to talk. People want to share their science. There's a lot of very nice people out there that have barely been turned out away from an episode. I mean, every time I reach out, people say yes. A couple times, no, they've been very busy or something has happened, but overall, most people do say yes. And of course, record the episode. And then this is the tedious part of it. your editing, which depending on what kind of what type of budget you have, you can definitely hire someone to do this. But if you're putting money into it and maybe you're not monetizing or anything, you have to do it yourself, or maybe know someone that will do it for free. Um, but editing the episode, you have to make sure that as you're talking, right, you lose your train of thought. You do things like or throat sounds, and you start taking long pauses. So you take those away, and then no, I don't think anyone likes listening to themselves. So that's also a tedious part. You're editing, you're hearing yourself. Then you have to make sure that your edited product is actually good. You didn't make any mistakes, so you have to listen to it again. And then once, if you want people to hear it, promote it through social media like YouTube. I go to conferences to promote the podcast also, talk to people. I hand out stickers and let them know, hey, this is something that's out there, right? It's a lot of work, especially, I'm not famous. I wasn't a famous scientist that started a podcast. I'm a medical laboratory scientist working in Florida that decided to do a podcast. So not too many people knew who I was. So you really have to put a lot of effort if you want people to know about your product. And this is just something, if you want to do cover arts for your episodes, you can also do that. There's some resources out there. Some are free, some are not. But just so you have it in context, one episode can take about 6 hours from start to finish without promotion of social media. And that's, the average. And I publish weekly, so I really have to stay very organized with this. The promotion, right? Depending on what you want, you're putting in different social media, letting know people that's out there. So these are the ones that I actually put my podcast out there on. And just so you have an idea, one post takes about 15 to 20 minutes on all these places, because you kind of put in the post, then you put in the comments, and you're going back and forth and things like that. So it's very time consuming. And then if you want to promote one episode daily, so you have to make time for that on top of the 6 hours that you're working on an episode. So what can you find in my podcast? Of course, information about biochemicals, morphology is very heavy on clinical micro. I do go sometimes outside of clinical micro, and I don't like an episode about marine microbiology. I talk about environmental, but definitely very heavy on clinical micro. I talk about susceptibility, so much information. I actually started a series within the podcast where we actually break down the antibiotic classes. So we talk about them. That way, people that work in this field, or for your general knowledge, you can know, hey, okay, this antibiotic works for this organism. These are the limitations and things like that. So a lot of information, and we're putting it as very simple as we can. We also bring guests, subject matter experts. I'm going through some journals or through social media. People share that, hey, I published something, and then I look at it. It looks like it's a good fit for the podcast. I read it, reach out to the author, and then, we schedule something, and then we work on the script and make the episode. I also started doing a Spanish series where we started going over some of the episodes in Spanish. And I think that really helps people with a little bit of that might have a language barrier. I think that sometimes, and especially in other parts of Latin America and in Puerto Rico as well, sometimes some people, right, you go to school and your textbooks are in English and you kind of understand, but then when you go out there and you start speaking it, right, some people have to kind of translate in their head and learning all these terms. So we started doing them in Spanish to kind of make it a little bit easier for those students that might need that extra, extra step to kind of put all the concepts together. And also bring awareness to the medical lab sciences profession that I talked about before. Not too many people know about it. They find out later in life. Also talk about microbiology, what jobs can you work in the microfield? What the options are there. So bring teachers, people in research and things like that. But what are the main things with my podcast? It's about that I make it in a way that students and professionals with different levels of education can understand it. And that's sometimes I think that there's some people that put their science podcasts out there that are great, but sometimes the level that they go in, it's like almost, you almost need like a PhD or being heavily involved in research to kind of understand everything. So I'm trying to make it more where everyone can. And hey, you're a student, or maybe you're working, you need a little bit of a refresher, you can understand it. Some things you cannot explain them very simple, unfortunately, but we try. So it's about microbiology in simple terms. It also, you deliver it in an easy format. It's free. You can listen to it as many times as you want. And right, it takes the life factor into consideration. You can pop that thing in while you're driving, right? Maybe you're, I don't know, folding laundry or making dinner or whatever. And you pop in a good, quick 20, 25-minute episode, and you learn a little bit. At the same time, you're keeping track of all the other things. So, strengthens your learning. It can also be used as a tool for students. Now, as of right now, what have I gained from doing this? Well, professional knowledge, just the fact that you prepare for these episodes and you do the research, you read articles, you talk with experts, right? Your professional knowledge just really, really increases. And I'm very happy that I reduced some of the barriers in learning. I have met people that this has helped them. Hey, I took this, I used this for my exams. It helped me. I didn't know this about this organism or this. So thank you for that. And that just is very fulfilling. And as I mentioned, for me, it's very therapeutic and I love talking about it. But then when I started meeting people that this actually made a difference with them, that is such a great feeling. Um, and I have made some connections. I have met some great people. I've spoken with people from all over the world. I've done series with people from other podcasts. I did one from Febrile, which is based in the US, Microbial, which is in South Africa, and then this one, they're infectious disease physicians from the UK. And it's also a freeing experience for me. I felt like I'm doing something that is just, this is for me, the impact. This is something that I created. I'm helping people. I'm making things easier that they were for me, and I'm putting it out there. So it was definitely freeing. It's just making that difference is it's just a great feeling. I mean, that's all I can say. I really love it, and I love everything from it, from the process to the end product. It's just, I don't know, it's just amazing. So a little bit about numbers, right, and impact and reach. I started in May of 2021, and since then, the episodes have been released weekly for the most part. And just some stats, so I have released over 150 episodes by now. In March of this year, I passed the 100,000 downloads, which that was a huge deal for me, and it's been very exponential. I reached 10,000 in 13 months of the podcast. And then I think it's been over 2 years when I reached 50,000. So before I hit the 3 years, I reached 100,000. So it's great. Over 48 countries have listened to the podcast. And of course, many, many wonderful guests from all different parts of the United States and from other parts of the world as well. If you want to reach me, and this is something I always say in the podcast, via social media or via email, definitely I invite you to check it out. As I said, there's no subscription cost. It's free. These are some of the socials that I have: Instagram, on X, Twitter, TikTok. I do have a YouTube channel, email if you want to reach out that way. And of course, the podcast link. You can subscribe to it. It's on every podcast platform. So I know that, right? Very popular. A lot of us either use Apple Podcasts or Spotify. It's definitely on those two and all the other ones that you can think of. So whatever your choice is, you will find it. It's as simple as going, searching Let's Talk Micro altogether. So I invite you to subscribe and follow. And if you have a topic that you think will be good, if you think that you will make a great guest sometimes, you're definitely feel free to reach out via email or via social media and let me know of your idea. And I'm also trying to do more episodes in Spanish as well. So if maybe you don't feel too comfortable doing it in English, we can definitely do something in Spanish as well. And of course, I'm a microbiologist. I'm not going to end this meeting without giving some visuals of the cool things that I see in the lab, right? Cool from the science point of view, not cool from recovering from a patient. Of course, it's just when they have these things, it's not good, right? There's something going on. But as I mentioned, serratia, Aeromonas, Hydrophila, Bracibacterium indologenes, Stenotrophomonas maltophilia, definitely a very dangerous pathogen, and Pastorella multocida, which is normal flora in cats and dogs. And then, you get things like a dog bite or a cat bite, and it can cause infections in humans. Okay, I think that's the end of my presentation. So now I give it back to the society and open the floor for any questions.
Thank you, Luis, for your presentation. Very interesting. This is the Q&A section. If you have any question, you can ask Luis. I got a question for you.
Mhm.
Right, in your podcast, Let's Talk Micro, you have covered a wide range of microbiology topics. What has been the most impactful or difficult subject discussed, and how do you select the topics and expert for each episode?
Okay, that's a great question. So I think that the basic outline of the podcast, it's eventually go through like all the microorganisms, mainly the ones that you see in a clinical presentation. So definitely starting with bacteria and then moving on to fungi and parasites. So in a general order, kind of like the way that you will learn them going through like one of these medical lab sciences program. So that's the basically like the backbone of it. And then after that, as I go through it, one of the things is I also love bringing guests because it also like shines a light on the podcast and provides some great information. So what I do is if I see a publication that I see that is relevant to what we do in the lab, maybe something about a drug and how it's working, or about a case of a bacteria that they found someplace, about how to identify it, or that's how I choose most of my topics. I think the most difficult, and it's not really difficult, but it's a lot of information. But I love doing it. It's the series that I'm doing about antibiotics because that's like a lot of information, and it can be very daunting when you're in the working with these cultures and you're by yourself or you don't know what to do, and using that information and making it more accessible and maybe a little bit easier to understand. It's very fulfilling. So that's one of the topics that I enjoy the most talking about in the podcast.
Thank you.
Well,
Anyone has a question?
Hi, Luis. My name is Rafael.
oh, hi, Rafael.
Luis, thank you very much for taking time to do about your career and your important mission of science communication through your podcast. And on behalf of the Puerto Rico Society of Microbiology, thank you very much for your time. And I have one question. How do you think podcasting can influence the scientific education and public awareness of microbiology?
I think, yes, I think you can do, it's doing a great, podcasting and social media, but I think that it is a great platform um, to bring more knowledge about microbiology. And I know like social media is really taking off, and you see a lot of scientists, sharing this information via different platforms. But it is a great way by presenting your topic and um, talking about your research and things like that, and from anything from like bringing awareness about medical laboratory scientists. So I think this is a great time, and it's such a convenient format because even if you can talk about any topic, and then you don't have to listen at it all at once. You can pause it, split it. So it is a great time. So I highly encourage. I think I've seen some scientists doing it out there too.
Oh,
Sorry, can you hear
okay.
me?
Yes.
Oh, sorry. Yeah, so it is definitely, I encourage people if they want to come up with something like this, do it. Just be responsible in the fact that with the information that you're putting out there and be consistent with it. But it's definitely it's a great format where you can reach out a lot of people.
Thank you. Any other question for Luis?
Angélica Rosado Quiñones and Orlando Soto Jimenez has raised their hands.
Hi, great presentation. I wanted to ask you, how time consuming is to have a full-time job, but do podcasting on the side?
How time consuming it is? Oh, very, very. I have no life, and I kind of joke about that, but no, it is. If you really want to put a good product, and in my case, it's not the only thing. Like I work full time at a hospital. I teach. I'm working on my master's, and I do this. So my semesters are very heavy with a lot of work. I think you just have to stay very organized. Um, Especially with podcasting, if you have a good idea of what you have, if you bring guests, try booking, if you have, okay, the next 2 weeks, maybe I don't have as much to do, try to book more than one guest. And things like the summer, try to maybe record 2 or 3 episodes. So what is called like episode banking. So if you're able to do that, go ahead and do it. But it's just being very organized. So I know that I'm doing, you typically try to stay organized. And I know that, okay, maybe by Monday, for example, I know that I have to edit, let's say. By Tuesday, I have to be listening to it to make sure that it's good because I publish on Thursdays. So I do that. If I'm going to travel and I want to publish, then I have to really sit down and maybe record 2 or 3 and then upload them and make sure that everything is good. So it's just organization is the key. But if you're doing everything yourself, prepare yourself to, you're going to be very, very busy. It's just the way it is because it's just, if you want to put a good product, you have to, unless you get help. I mean, if someone edits for you and maybe they do the social media and the promotion, then it's a little bit easier. But if it's just you, it's going to take, as I say, maybe 6 hours per episode. So you have to factor that when you're working and doing other things. I mean, then again, just to close on this question, it also depends on the frequency of your episodes. I mean, if you decide that you're going to do a podcast where maybe you publish monthly, then maybe that's a little bit easier. But me, I do it weekly, so I stay busy.
Thank you.
My pleasure.
Now, Orlando Soto Jimenez, it's your turn to ask.
Hey, can you all hear me?
Yes.
Perfect. Good afternoon. So I was wondering, because I know that you mentioned at some point that a lot of professionals are like they want to share their knowledge, but how do you handle the networking, and like reaching out to, because I know you have like, great guests in the podcast. Like, how do you handle that, reaching out to these professionals to have them in the show?
Well, it actually, it's done a lot via email, mostly. And I think the first time I started my podcast, I did like I think it was like 7 months, like no guests. It was just me talking about organisms. And then I kind of wanted to expand the reach, and I saw this article, and I'm like, okay, this looks like it's a good fit, and for the podcast, so let me reach out. So I saw the email on the article, and I sent an email with an invitation, and they say yes. So it's just the only thing they can say is no. Some people might not answer, but it's just you see it and you reach out to them. And my surprise was that people, they're not, it's not a surprise they're professional, but they're very friendly, and they do tend to say yes. I mean, they like sharing their science, and if they work on something and they find it pretty cool. Not too many people doing podcasts, especially when it comes to clinical micro. So they actually find it also like a cool experience. I get guests like they're like, okay, I never done a podcast before, and they might feel a little nervous, but they want to engage in the experience. So it's just, yeah, you see them, email, and then if you go to conferences, if they're presenting something, then go talk to them. Introduce yourself and say, hey, I have this, and I think this will be a good fit. Is this something that interests you? And well, if they say no, well, there's nothing you can do. But at least you tried. So that's the worst thing that you can get a no. And then you just look at the next article and maybe find the next person. That's it.
That's really refreshing to hear. So thank you.
You're welcome.
So we have a comment in the comment section. It says, "Hi, Luis. I just wanted to share that as an introvert and microbiologist in the medical device industry, I really see so much of myself in you. Your work not only inspires me personally, but it also fuels my passion for microbiology and helps me stay motivated in my career. I just wanted to say thank you for everything you do. Your insights, authenticity mean a lot. I look forward to your growing podcast."
Oh, well, let me say, thank you so much for that. It's just, it really means a lot. And as I mentioned before, when, you're talking to a computer and you don't know at times, who's listening to it. But when you know things like this where you are, and especially as a fellow introvert, right, it's kind of hard, and we get drained, and sometimes, just being out there and doing our jobs, and that interaction, it can be very draining. So knowing that I inspire someone or I make a difference, it's really great. I think I still remember the first time I went to a conference and someone actually recognized me and said, hey, you're the guy from the Let's Talk Micro podcast. One of the coolest feelings in the world. But I'm definitely very happy that I'm making a difference with this, and I plan on doing this for a long time. So thank you for your words. They're very kind.
So for now, the Q&A section is closed, and thank you all for your time and for attending this webinar. I would like to take this opportunity to invite you to the semiannual meeting, which will take place on October 26, 2024 at the amphitheater of the University Hospital in Bayamón. Title Challenges and Opportunities, Interplay Between Emerging Infectious Diseases and New Technologies for Detection and Protection. I hope to see you all there. With that, we end this webinar. Have a nice evening, and thank you, Luis Plaza, for your time.
All right. My pleasure. Thank you for having me.